Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And I wanted to go over a data set that I don't often talk about, but is nevertheless very important. And that data set is known as NHIS, or National Health Interview Survey. So I talk about National Health and Nutrition Examination Survey all the time, but this is one that I think people need to use and be aware of. So this is being actually collected since 1957, and it covers a wide variety of health topics, and that's collected through personal household interviews. So it's not as robust as NHANES, because that has blood samples and urine samples that they collect. Here there's data on tracking healthy information status, healthcare access, and progress toward achieving national health objectives. So you can see on the left the 2019 redesign and what's new. That's something that's always good to look at. Also, the objectives contain, and this is pretty self-evident, but survey participants, survey data and documentation, publications and products, and then interactive data query system. Again, rediscovered the National Health and Interview Survey. Their slogan is "Respected, Reliable, and Redesigned." There it is, and there's actually a whole transcript from it. And then you have sleep difficulties. So this is pretty robust and includes a lot of information. Access to care by sexual orientation is an important one. Of course, the access is less among gay and lesbian individuals. So 1 in 10 children live in households that experience food insecurity. Just think about this. This is tragic that children have to even face. And so 18.8% of non-Hispanic blacks were in fact food insecure. Just think about this for a second. We have a legacy of treating minorities in a more inferior way. And to add to this insult to injury, you have a striking non-Hispanic black food insecurity percentage. Then, of course, Hispanics are have food insecurity way more, 15.7%, and then 6.5% only among non-Hispanic white males, or actually white children. Dental exams or cleanings declining for the children overall. However, the largest decline was among children aged 1 to 4 years. And this is not surprising, because it's actually more difficult to treat children aged 1 to 4. But nevertheless, indeed, it's very important. So overall, which is surprising to me, 83.8% to 8.9%, there's a decrease, but I wonder how much of it has to do with the pandemic. Although the pandemic was full swing by 2021. Anyway, so 1 to 4, there's still a discrepancy, and obviously it went down. So these are social and emotional support among adults. 77.5% are always or usually receive this social and emotional support they need. Again, there's quite a few kind of cartoon-related percentages that are presented here. Urban versus rural, and pretty much even. Rural areas are poorly getting health care, but this is something that's there. And then there's more, just over half, consider this, of children aged 6 months to 17 years received a flu vaccine. That is tragic, only 53%. And then between the years 6 months to 4 years, 61.2%. 5 to 11 years is 53.6%. And 12 to 17 years, 46.7%. So as the age goes higher, the percentage of coverage goes down, and among 12 to 17 years, there's lowest flu vaccination percentage. So the younger age individuals are not getting the flu vaccine. So multiple chronic conditions among U.S. female veterans. Female veterans are more likely than female non-veterans to have 2 or more conditions chronic. Male veterans are more likely than male non-veterans to have 2 or more chronic conditions. So as you can see, this is an area that there could be more research that's going to be completed. Non-Hispanic white and non-Hispanic black adults were most likely to experience any severity of depression symptoms in the previous 2 weeks. Non-Hispanic Asian or Hispanic is 16.9%. Non-Hispanic black and non-Hispanic white is 19.3%. There's only 3 more left. Mental health treatment, nevertheless very important among U.S. adults and children. 2019, women were more likely than men, while boys were more likely than girls to take prescription medication for mental health in the past 12 months. So among adults, 20.6% and 10.7% of women over men take the medication properly. And then boys are adherent more so than girls, 9.8% and versus 7.0%. We got 2 more left. American Indians or Alaska Native adults living in rural areas are more likely to have diabetes. And this is from data that's been collected over between 2014 to 2018. And American Indian or Alaskan Native, like I said. So rural areas are already getting poor coverage in health, and so compound that between rural versus urban, that just makes matters worse. So women more likely than men to use yoga, meditation, and chiropractors, which are alternative medical sources, which provides a bit more increased health and overall proper health. And then, so that was the last one. This is actually sleep trouble sleeping and staying asleep is worse for women than men. And I think we already went over all of this. So this was a good kind of slideshow that you can go over, and then Respected Reliable, that's another good place to look. And then so there's the early release program and survey reports and data linked to NHIS. And then questionnaires, data sets. I explore you to go into all of these, but this is, for instance, for survey instruments, you can go into that. And there's all of the data sets that are available. And usually the data set is not very easy to find. This is very organized, this website by the CDC. So it has all the components that are needed. So this has many different questions. Actually, it's very comprehensive. Just to look at what they have new. Early release of estimates from the January-June 22 NHIS, and then wireless substitution. Early release of estimates there. And then geographic variation in health insurance coverage. Demographic variation in health insurance coverage. A lot about health insurance coverage. Telemedicine, which is some important information. And then mental health treatment among adults ages 18 to 44 in the United States. So I'm not going to read through all of them, but these are all very important in addition to the the PowerPoint that I went through. So this is all there is. I think this is a good overview of a National Health Interview Survey. If you have any questions or anything, you can place it in the comments, and I'll get back to you pretty quickly. Thank you for listening.